Down syndrome, also known as trisomy 21, is a genetic disorder caused by the presence of an extra chromosome 21. This condition results in developmental and intellectual delays, and it can be detected during pregnancy through various screening and diagnostic tests. For health and beauty enthusiasts, understanding the symptoms and the diagnostic process of Down syndrome during pregnancy is crucial. This guide provides an in-depth look at the indicators and testing methods associated with Down syndrome in the prenatal period. Prenatal screening tests. During pregnancy, several screening tests can indicate the likelihood of a fetus having Down syndrome. These tests do not provide a definitive diagnosis but rather assess the risk level. The primary screening tests include first trimester screening. This test combines a blood test and an ultrasound to measure the nuchal translucency, which is the fluid at the back of the baby's neck. High levels of this fluid can indicate a higher risk of Down syndrome. Second trimester screening, known as the quad screen. This blood test measures 4 substances in the mother's blood: alpha-fetoprotein, human chorionic gonadotropin, estriol, and inhibin A. Abnormal levels of these substances can suggest an increased risk of Down syndrome. Cell-free DNA screening. This advanced screening method analyzes fetal DNA circulating in the mother's blood. It is highly accurate and can be done as early as the 10th week of pregnancy. Diagnostic tests. If screening tests indicate a high risk of Down syndrome, diagnostic tests are recommended to confirm the diagnosis. These tests are more invasive and carry a slight risk of miscarriage, but they provide definitive results. The main diagnostic tests include chorionic villus sampling, CVS, performed between the 10th and 13th weeks of pregnancy. CVS involves taking a small sample of the placenta to analyze the fetal chromosomes. Amniocentesis, conducted between the 15th and 20th weeks of pregnancy. This test involves extracting a small amount of amniotic fluid, which contains fetal cells, to examine the chromosomes. Physical indicators. In addition to these tests, there are physical indicators that can be detected via ultrasound during the second trimester, typically between the 18th and 22nd weeks. These markers are not conclusive but can suggest the possibility of Down syndrome. Shorter femur length. Absent or small nasal bone. Increased nuchal fold thickness. Echogenic intracardiac focus, a bright spot in the heart-dilated brain ventricles. Duodenal atresia, a blockage in the intestine. Symptoms during pregnancy. While the fetus itself shows no direct symptoms that the mother can feel, certain conditions in the mother can suggest an increased risk of carrying a baby with Down syndrome. Advanced maternal age is a significant factor, with women aged 35 and older having a higher risk. Additionally, abnormal results in routine prenatal blood tests can prompt further investigation. It is important to note that the presence of one or more of these indicators does not confirm Down syndrome. Comprehensive testing and consultation with a healthcare provider are essential for accurate diagnosis and to prepare for any special care the baby might need. In conclusion, understanding the various symptoms and diagnostic processes for Down syndrome during pregnancy helps expectant parents make informed decisions. For more detailed information and to see visual aids, we invite you to watch the associated videos in our playlist or the recommended video in the description of the video you just watched.